Hi, in this video I'm going to continue to go over injuries that are common to exercise and sports. We'll start with cuts. A cut is also called a laceration in the medical field. Cuts usually happen when coming into contact with a piece of equipment, a hard body part, or the ground that breaks the skin and causes bleeding. If the bleeding is very fast, especially if it's spurting, get medical help as soon as possible. A scrape is also called an abrasion, and when they're minor, they're sometimes called raspberries. Scrapes occur when your skin rubs forcefully against something rough, damaging the top layers of skin. A minor scrape isn't an immediate problem, but a deeper scrape will probably need medical attention. Whether it's a cut or a scrape, these injuries prevent your skin from doing one of its big jobs, protection. A scrape or cut gives certain bacteria and viruses a way into your body, so keeping scrapes or cuts properly cleaned and covered is important to avoid infection. Next we have fractures. A fracture is an injury to a bone, and there are different types. Fractures can be open, where the bone comes out of the skin, or closed, where the bone stays inside the skin. The bone can be cracked or broken into two or more pieces. In any case, identifying a fracture isn't always obvious, but if there's a lot of pain, a loss of motion, bruising, or the part is deformed, you should get medical help as soon as possible. In the next video, I'm going to go over what you can expect when it comes to first aid for the injuries that we've discussed so far. But remember, if an injury is serious, or you're not quite certain how serious it actually is, get professional medical help as soon as you can. In the United States, calling 911 will send help and provide basic first aid information if necessary. Okay, that's all for now, but before you go, here's a word from the professor.
Hello. I just wanted to add that if you find this information interesting, you might want to consider a career as an EMT or a paramedic. You'll see them most often in ambulances, and they are often the first person you'll see if you have a medical emergency. EMT stands for Emergency Medical Technician, and they're responsible for quickly identifying how life-threatening injuries are, as well as administering certain medications and other life-saving measures. A paramedic has the same skills as an EMT, but can do even more, and requires more detailed training on how the body works. Depending on where you live, training to become an EMT could be 150 hours or more, and to become a paramedic, well, it will take closer to 2 years. Still, it's not as much time as it takes to become a nurse or a doctor in hospital. Really? Who keeps doing this? I'm starting to think that you don't like me.